All right. Good afternoon. Today's lecture centers on our week 5. We shall discuss how clinical assessment is done. So those of us who are clinicians, nurses, doctors on this platform, when we say clinical assessment, it doesn't mean the person operates in the hospital. We say clinical because we use it as basis to identify any psychotic problem someone has. That is a diagnosis. So when we are diagnosing, we use the term clinical and not necessarily you, the counselor or the psychologist, is operating from the hospital. So clinical assessment is a systematic approach to understanding and diagnosing mental health conditions. This involves gathering detailed information about your client and your client's psychological states, the symptoms that are evident, history, and their overall well-being. So this assessment process is critical in guiding any treatment plan you have for your client. So we shall discuss diagnostic interviewing techniques, assessment of mental health disorders, especially depression and anxiety, suicidal risk assessment, trauma assessment, and so on and so forth. So when we say diagnostic interviewing, what does it mean? Diagnostic interviewing is when you engage your client, asking your client questions pertaining to the problems or the issues they come to your facility with. In doing this, you'll be able to understand or appreciate what is underpinning their current state, of which they avail themselves to you. So it provides a foundation for understanding the concerns a client have, the history that they carry along, and the potential mental health conditions that may be eminent in their system. We have different types of diagnostic interviews. We have the structured one, where the questions are given, you follow those questions, you don't go to add anything, you just go straight. You just go straight. If it is 1, it's 1. If it is 2, it is 2. So these follow a standardized set of questions based on a diagnostic criteria. For example, we have the structured clinical interview for Diagnostic Statistical Manual 5, SCADE, a tool used to access and diagnose major psychiatric disorders. What are the advantages? This ensures consistency across different clinicians. It also reduces bias because it is standardized. Sometimes, because of how structured it is, it becomes highly rigid. And when it is rigid, it's a disadvantage. Second, we have the second one, that is semi-structured interviews. Semi-structured interviews. These are interview questions that give way for you to add follow-up questions when the need arises in your clinical interviews. And this one, they combine a set of standardized questions with flexibility for you to explore specific areas of concern when they come up in the session. Example are the mini international neuropsychiatric interview, mini international neuropsychiatric interview. This one is a semi-structured interview guide that is structured as well, offer you the opportunity to also have your fair addition of information that you think you need to explore. What are some of the advantages? It provides a balanced structure between flexibility and the structure. Again, it allows for a deeper understanding of the conditions that your client come to the facility with, because it allows you to probe more, not only by the standard questions. However, it requires you, the clinician, to have expertise in knowing more so that when you are deviating, you get to know that you are deviating from the honors. And that is a disadvantage. We have the third one. This one shouldn't have been. The third one is the unstructured. The third one is unstructured. It never showed up. The unstructured, we don't have any standardized. The questions are just given, and you can start from anywhere and end from anywhere. In this sense, you are open to several questions that you can pose to your people. Sorry, we didn't bring that one in. And this one is more flexible, just that it can delay you as a counselor or as a therapist in a particular situation. We have the fourth one being the culturally sensitive interviewing. Sometimes when we are interviewing people, you consider the culture you find yourself, the kind of questions that you pose to that particular individual from the culture, so that you not be saying things that you're supposed not to say. That can trigger issues that you cannot even handle at the end of the day. So you use culturally appropriate language and understanding the non-verbal communication that a particular culture possesses and use. And we have a tool for that, Cultural Formulation Interview, CFI, Cultural Formulative Interview, which can be found in the Diagnostic Statistical Manual 5, which helps assess the role of culture in a client's condition. Remember, we all come from different cultures, and the way we approach situation in a culture may be different from another culture. So when we are approaching a client from a particular culture, you factor all those in order not to invite yourself any negative feelings or interpretations that they will bring forth. So that is one thing. Any other concern? Then we move on. Any concern? If you have no concerns, we can move on. Any concern, please? All right. It appears we have no concern. Okay, the third one rather came before the fourth one, and that is it. We have said it already. We have the assessment of mental health disorders. We all are mentally disordered in one way or the other. We all on this platform, we are mentally disordered in one way or the other. And how are we mentally disordered? If you just wake up one day and start laughing without any issue of concern, that calls for the laughing, you are mentally disordered. But this one, our focus will be on depression and anxiety that require thorough assessment using clinical judgment and standardized tools. So depression assessment is characterized by persistent sadness, loss of interest in an activity, feeling tired in your system, changes in your sleep, you lose appetite, you feel that you are not important in any way. The common one we have is the Beck Depression Inventory. Beck Depression Inventory. And the Patient Health Questionnaire, PHQ, Patient Health Questionnaire. So the Beck Inventory is 21 items. It measures the severity of the symptoms of depression. And we have the Patient Health Questionnaire, that PHQ-9, short and essay, short and easy to administer. They are just 9 items. And it's used in primary care settings to assess the severity of depression. So if you are a counselor in your facility and you would want to ascertain the depression level of someone, whether someone is depressed or not, you can use any of these two to do that. And we have the Hamilton Depression Rating Scale, HAM.D. HAM.D. And it is a clinician administered to measure the depth of, not the severity, the depth of depressive symptoms, how deep the situation is, and not how severe it is. We also have the anxiety assessment. It includes a general anxiety disorder, a panic disorder, social anxiety disorder, and then the phobias. So the common assessment tools are GAD-7, which is a self-report inventory, only 7 items. The Hamilton Anxiety Rating Scale, HAM-A, clinician administrator evaluate the symptoms of anxiety. And we had a state-based anxiety inventory type. It differentiates between temporary state and anxiety and long-term anxiety, that is trait. So this one, the short and the long issues are ascertained, or they are being accessed using the same scale. It means it has 2 dimensions. 2 dimensions. Any question? Any question, clarification, concern? One of you is making the class unaccommodating. The person is making unnecessary noise. Olivia, I'm going to mute you. All right, I've muted Olivia. Now, let's carry on. Questions, please. We have discussed depression, and how it is ascertained. I indicated the tools that we use in ascertaining depression. The Beck Depression Inventory is set. The Hamilton one is set, and so on and so forth. If you have any question, you can give. If you have any concern, you can give. And before you do that, you must understand the features of depression. And depression is when you have persistent feeling of non-weightiness in you. You are sad. You have no feeling for anything, and so on and so forth. Any question, please, then we move. Any question, please? Clarifications, concerns? All right, one silence is being observed here. My assumption is that you are all following. You are all following. Now we have the process of mental health assessment. How do we profile the mental health situation? Process of mental health assessment. One, we have the clinical interview. The clinical interview helps you to gather the history of the individual that presents itself, and then the current symptoms that the person shows. We have the use of screening tools, and the screening tools are standardized, of which we apply to get to know more and understand more about the individual. We also have the behavioral observations, where when the person talks, you'll be able to deduce. You'll be able to deduce what the person is going through. And then their feelings and their thinking are all an issue of behavioral in nature. And we have the collateral information, where you go to the family members of the person who come to your facility to get to know what the person is going through, and they will tell you more. We can bring on board that of Kwade. Recently, I heard Kwade mom going to the radio station to tell and to tell what she has to say about her son. People wanted to ask what at all is going on in the life of Okomfo Kwade. Doing this is what we term as collateral information. And we have the formulating a diagnosis based on the DSM-5. Sometimes you ask a person some questions, and out of it, you use your DSM guide to see where the person is having the issue from, or International Classification of Diseases Criteria 11. That is Classification of Diseases 11, ICD 11. We can also use that to check what the person is going through and then ascertain it. And we have the suicidal or suicide assessment scale, which is also important for identifying people at risk of self-harm or suicide. Clinicians must assess both the risk factors and the protective factors to determine the level of risk. Key components of suicide risk assessment include direct inquiry, meaning you must ask clear and direct questions such as, are you thinking about harming yourself? Are you feeling that you are not important in your life? Do you have a plan to end your life? Have you attempted suicide before? This is what we term a direct inquiry. And we have a risk factor for suicide, where you see the person become so depressed, they become moody, bipolar, sometimes they become schizophrenic, they go out there unconcerned about their body and the way and manner they present themselves. And you also think about previous attempts in suicide. Maybe they may engage in abuse of a substance, drug, alcohol, and so on and so forth. And they feel like they are hopeless, and they feel like they are isolated. They feel like they have a family member who have ever died through suicide. And sometimes they can use lethal means. They drink some chemical and die, DDT, or they use a firearm on themselves. That is one thing. We call that one access to lethal means. We have the protective factors, strong suicidal support networks. You ask them all these questions. Do they have a family member who care for them or care about them? Do they attend a church or they join a particular group who care about them? You ask all these questions. Do they access mental care? You ask them all these and how they cope with the situation. All this will lead you to know what the person is going through and how best you stand as a counselor or a therapist to guide them or to help them to get away from the problem or the situation. And again, suicide risk assessment tools are there. Several of them are available. We have the Columbia Suicide Severity Rating Scale. It measures suicidal ideation and behavior. PEC scale for suicide ideation is also there. It also assess the intensity of the suicidal thought, the thinking the person go through. And we have the SAFE-T, Suicide Assessment 5-Step Evaluation and Triage. It's a structured tool that we use to approach suicide risk assessment. It's a structured tool we use for suicide assessment. We have other intervention strategies. Remember, when we are thinking about suicide, it's a risk, and we need risk interventions. Immediate support from those that you live with is called for. And you must plan for safety. So you help the client to develop a coping strategy so that they will not think that ended their lives. Hospitalization. If there is an imminent risk of self-harm, sometimes you can take the person to the hospital to be placed there in a secret room and be advised on what to do and what not to do. It does happen. Last year on campus here, a lady, because of a gentleman, attempted suicide and drank Parazol. When she drank it, they took her to the hospital, and that is hospitalization, so that they walk her through therapeutic procedure to get herself away from that. And funny enough, now they are living together happily, not married, but courting. They are all doing their service on campus of UEW. We have a follow-up care where you check on the client, how they are faring, or how they are managing the situation. And that is what we term as a follow-up care. Trauma assessment. Trauma is also one thing. Trauma can be silent, but very bad. And it can go against us. Trauma assessment helps you to identify people who have experienced abuse, violence, natural disaster, or any distressing event. And the signs of trauma are many. We have the emotional symptoms where you feel anxious, you feel depressed, you have mood swings. We have the cognitive symptoms where you feel difficulty in concentrating and you become highly intrusive, talking anyhow. Behavioral symptoms, you don't want people to see you, you avoid individuals, or you engage in aggressive behaviors or take drugs. And the physical symptoms, we have the fatigue, lack of sleep, that is insomnia, and you have headaches all the time. They are the physical symptoms. So how do we access this? We have the post-traumatic stress disorder checklist, PCL-5. PCL-5. So it assesses PTSD symptoms based on the DSM-5 criteria. We have the trauma symptom checklist. It measures trauma-related symptoms such as anxiety and dissociation, and childhood trauma questionnaire. Remember, not all of us are the same in terms of life. So the age of the individual determines the kind of tool you present to the person to go through, and they pick something for you to tell. And we have the ACE, adverse childhood experiences, things that you went through as a child when you were growing. We have assignment for you on this. I first of all sent you some inventories when we're doing the week 4. So those inventories are to be used on this assignment. When you do it, we'll score from there. You study it and follow it for that. This one is individual works. Each of you is going to do it. You choose just one of them. I'm taking a shot of it and I'll place on your page. And present in our next face-to-face meeting. You present in our next face-to-face meeting.
Sir, please, can you explain again the assignment? Thank you.
The assignment is on the page. Conduct a diagnostic interview, 10 marks. You need to conduct an interview with a friend or a classmate who is willing to participate in a simulated diagnostic interview. Conduct the interview between 15-20 minutes. Structured, semi-structured, or unstructured, using any of the diagnostic tools that I shared with you. Structured clinical interview for DSM-5 or the mini international neuropsychiatric interview. Focus on collecting information related to the mental health history, symptoms, and daily functioning. And again, submit a 1 to 2 page summary that includes the type of interview that you used, the key findings you have, and your reflections. That is what we mean here. And ensure confidentiality and ethical issues are considered. Try to obtain informed consent from the person, which is very important. And your task 2, that one will be 5 marks. Select one mental health disorder, either depression or anxiety, and administer a screening tool to a volunteer. Recommended tools are Depression PHQ, that is Physical Health Questionnaire 9, or General Anxiety Disorder 7, or the Hamilton Anxiety Disorder Scale, or Beck Depression Inventory. You can use any of this. Score the responses and interpret your results. Write a 1-page report, including the chosen disorder and assessment tool, key findings, and your recommendations for assessment. You must give us ethical note on that. And that ends our lecture for today. I've placed it on your platform, and you must go through it and do it individually. So 2 tasks for you. One 15 let me see the first one. The first one is 10 marks. The second one is 5 marks, 15 marks. So do that and submit in our next meeting. Any question? Any question, clarification, concerns? So if you have no questions and you have no clarifications, then we call it an end to this particular course. Again, I'm going to send you a lecture on Intro to Counseling Psychology. That one is recorded already, and you have it. Another one will come for the counseling techniques, and that will end the day. I'm giving you 30 minutes to go and reflect and come back, or if you want all to be Zoom-based recorded, you let me know. Then I'll send all like that. Then you have a time for